Dr. Soundarajan, who organized the team, and Dr. Manogaran, who coordinated me for this event, and Dr. Vijay Rani, Director Research, and Dr. Palaniswamy, Vice President, your veterinary, and all the participants from different parts of the country, and my joint director, Dr. Sandal, who is handling the communicable disease, and our senior faculty, Mr. Sekhar. First I need to congratulate each and every one of you for organizing this third chapter of National Conference, which covers about your climatic change effect on the animal health, productivity, and all your mitigation strategies. In fact, I used to passionate about the veterinary colleges. My college is supposed to be a close by college. My undergraduate is in Kilpauk Medical College, just opposite. See, in fact, when we used to interact with the veterinarians at my time, we used to study only one art with a few chambers, but you used to study so many arts with so many chambers, so many complications, and the way you advance was really, it was fascinating. See, when you are about to talk about IVF, you already given an artificial insemination. In fact, I used to see an ICSI model here long before we started doing in vitro fertilization. So that is the way you grow. In fact, when we talk about biosafety, you are already level 3-4 in biosafety level, and the research also much ahead of us. See, in fact, most of the areas, the veterinarians are ahead of the human health, maybe for different reasons, which the common one I actually feel is that in a country like us, this is the economy which is driven, and it is the industry also got a bigger role to play. And the topic which you chosen for this event, the climatic change and the impact on animal health, the productivity, whatever it is, it's a really an hot topic. It's not only the hot topic, recent topic, but it is a really an each stress, the impact which it creates not only on the animal but on the human health is really a big one. See, what and all we face as a challenge in the human health, you are already facing it. See, ultimately what we talk about is the impact of this heat or whatever it is, we have seen in our eyes in the recent years. See, either it could be an Himalayan challenges, Himalayan belts, or in a recent Wayanad in Kerala, or even our own state, Chennai plates, or in southern Tamil Nadu plates, Tuticorin and Tirunelveli are affected. It has become universal, and in fact, the challenge is that it is coming in a increased frequency, increased severity, and also getting into a newer areas which we have never experienced. See, this is the way we need to prepare, and the impact which it creates is much bigger. See, to say a few example, dengue used to be a very seasonal infection for so many years. Now it has become a bigger problem, it has become a perennial problem, and the severity is becoming more, and because of the climatic and environmental is the big impact. See, my understanding is that since most of you got the prize, I need not to tell you about the way in which it has to be handled, but ultimately it affects your physiology, it affects your metabolism, your immunocapacity, and ultimately what it leads is that your intake is becoming less, or the utilization of what you take is becoming less, your production, either it's a meat or milk, will become less, and ultimately your reproductive capacity is going to come down, or the maternal complication may happen. See, what ultimately it leads to is that the big economical loss, particularly in country like us, it is mostly a single farmer, few cattle or few animals. The impact is much huge. So it's a real time that we need to definitely take care of these events. And second related event is your water scarcity. See, the climatic impact gives water scarcity. Naturally, the grazing field, whatever it is going to come down, or the diverse plant which used to be it will come down. The medicinal impact will come down. See, ultimately, all these things again leads to a lesser production, lesser yield, lesser reproduction, ultimately the economic loss. See, this is the big challenge which each and every one of us should do our little part. See, otherwise, it's not that someone is going to come and do and we are going to get out of this. See, it is already the damage has happened. So, each and every one of us, if we are able to do little bit of mitigations, definitely we can come out of things. To handle this, just quote our relevant example, we have a special program called national program for climatic health and the human health, climatic change and the human health. So this is where most of the challenges which we face, we are handling it. The direct impact, most of us very well known. So whenever there is a flood or cyclone, direct impact, your snake bites, your damage to the buildings, you get into it a bit. See, all those are direct impact. The indirect impact, now we started seeing as a dengue race, which is vector borne. And next is your non-communicable disease, which usually we think it will not have an impact. Either it is your hypertension or diabetes, is definitely got an impact on your climatic change. And now we have evidence to show that even the illness like mental illness is on the higher level because of the heat stress or the climatic damage which is happening. The second area which we were never related is your maternal child death. See, the heat has got a huge impact on the pregnancy now. The heat has got a huge impact on the maternal outcome. See, this and all, so far we are attributing to other reasons. Now this climate is also going to be a bigger problem. And the air pollution leading to your asthma, or which we call it as COPD, it's a big one, and it has become localized, or it has even become more common in an agricultural area. And heat stress leading to chronic kidney disease. Because of the continuous exposure, the prevalence is increasing, and it's more in the farmer and agriculture side. And our recent example is your H1N1, where this got a huge impact on the poultry side or the animal side. But once it is transmitted, we also face a huge impact, and it has become more prevalent. And with the cocktail of infection between an animal and human, any new thing may occur and we may become unprepared to handle. So this is what has happened in MERS, SARS, or in a COVID. The same thing can happen with any infection anytime. See, particularly when the domesticated animal is moving closer with your forest animal, the change of information or change of virus or change of genic material is very much possible, and it will have an impact. And recent Nipah outbreak, we had a case in Kerala. See, this also your close association with your fruit bat, getting infected, secretions, moving on to human cycle. This is all possible because we live in a same environment where virus, bacteria, see, all are living together. In fact, basic medicine, when you entered, we always talk about agent, host, and environment. Unfortunately, we restrict ourselves only to the agent, which could be a virus or bacteria. But the host to the challenges, whether it has got a sufficient immunity, whether it is already affected with a comorbidity, or the challenges in the environment, we forgot. See, this is the time we need to focus, because it's not only going to affect your health, but also going to affect your entire economy. And just to say one few example where we are all like to work together, it's your rabies. In fact, today it's an anti-rabies day. We commemorate with the death anniversary of Louis Pasteur. Manogaran, when you are coming, he was jokingly saying, so many years you've passed away and you find out the vaccine. Still, we are struggling to find a solution for a rabies. Still, it's become a bigger problem. In fact, before coming out, myself and my joint director, along with the Government of India team, released a SAFAIR, that is a state level action plan for elimination of dog-mediated human rabies. It's a document which we released. This we have planned or prepared together. So from our side, our secretary and other officials participated. Your side, when Mishra was there, I think. Animal Husbandry Secretary, Abhijit Mishra is your Commissioner, Government of India. Your Gopal. So he was there, he was party to it. We have prepared a combined document where it's a combined commitment both by the Health Department, Animal Husbandry, local body, together to have some strategic, a clear-cut view in which we need to handle to take away this rabies elimination. Otherwise, it's becoming a bigger and bigger problem. To cite few examples, 10 years before in Tamil Nadu, so we have around 1 lakh dog bite in a year. Now I am getting 8 to 9 lakh dog bites in a year. And there are so many road traffic accidents, so many other accidents because of the dog chasing. And the vaccine alone, ARV and RAG alone, I spend more than 14 crores in a year. And the death anytime it has increased to 38 in a year. So even with all your efforts, the rate at which dog bites rate is increasing, the cost at which we need to give them human vaccine is increasing, and the death is also increasing. It's in fact, this is high number of deaths considering almost 10-15 years. See, with all our efforts and things, we talk big things, but unfortunately, we couldn't handle the easily handleable solution where the solutions are the tools are already available. Somehow we couldn't do it, but this is the time where we need to work together as a One Health approach. See, in the document which we released, we have clearly highlighted there are certain things to be done by each and everyone, including the common man. See, otherwise it is not that only government will take a thing and get away all these issues. See, your pet is becoming a big problem. No one is against having a pet, but the pet need to be licensed, it needs to be vaccinated, because we have evidence to show that because of your pet scratch and things, there is a rabies death. See, we should not assume that pets are always safe unless and otherwise we vaccinate, treat them properly. It's also dangerous, particularly to the children who are not aware of the challenges. And who will take care of the community-owned dogs? The community-owned dogs is becoming a bigger threat, and unless otherwise there is a mechanism in which there is a community adoption or a community promotion, this is going to be a big problem. And next area which we feel is that, see, there are ways in which we need to segregate a little more. There is a designated smoking area. You should not smoke in certain other public places. In the similar way, there should be a designated area in which dogs should be fed. There should be a designated area, at least there should be a dog-free zone. See, where your children can play freely. See, this and all, we need to make it happen, otherwise it's going to be a big challenge. See, the bigger role, vaccination. The dog vaccination, definitely the animal husbandry should take a lead, because unless you take a lead, there is no one is going to do it. And it's not that strategically doing few vaccination a year, it needs to be done on a mass scale, covering area by area, community by community. See, unless and otherwise you do this in a month-on-month basis, covering the bigger area and community, we are not going to achieve that dog vaccination coverage of 70-80%. See, doing it one or two, whoever coming to our clinic or to the hospital will not reach. We should have a mission mode to reach them. This is one area. The similar way, your local body doing ABC for 20 cases or 30 cases in a day in a corporation like GCC will not serve the purpose. The rate at which it is multiplying is much beyond the rate at which we are trying to control. So we need to have a little more mass scale. At the same time, we are not against the animal, we are not against the pet lovers, but there is a within the law, within the provisions already given and read, we need to act together to get it done. So these are the few things which were in fact brought out in this note. And the another area which we are trying to know is that this breeding itself is becoming a bigger business. See, how we are going to regulate it? See, unless you regulate it, there are certain breeds which we cannot handle it here. And there are certain breeds which we cannot handle at this particular temperature. We need to regulate all those things. Finally, mitigation is the very area which we need to talk about it. When I go through my mitigation strategies for climatic and environmental, it's almost similar to your animal husbandry also. So, for example, we have a surveillance unit called Integrated Health Information Portal. So, where all the health events from different institutions are getting enabled and recorded. The similar way you have your animal surveillance. See, the surveillance main idea is that we need to know where it is happening and we need to track it. See, unless and other way you track it, you cannot identify the source. So, there's a big thing which is there, which we need to expand. Unfortunately, the role of community, the role of your smaller practitioners getting all these things notified is the big challenge. If you are able to bring everyone into the fold, definitely we can have a bigger surveillance to do it. And Madam was talking about your climatic adaptable breed. Yes, it's definitely you have that advantage. We don't have advantage in a human health. It's good, but at the same time, when you are uh, adapting the breed to certain properties, there is a possibility of your genetic erosion may happen. There is a possibility of genetic restriction may happen. See, this also we need to take into account. But the good part is that we need to develop, at least you have a capacity to do it, that we need to do it. And second thing which I am more worried about your water management. See, ultimately all these animals which are fed or grazed, we need to have a diversified feed. I think you called it as a forge, right? You should have it. See, otherwise it will go beyond this normal area, get into the other area which is not inhabited to them, and definitely it will expose to many other ticks, mites, whatever infection is there. See, we need to provide them a safe water. This is where your hydration. Otherwise, your unclean water definitely will go for infestations. Once the infestations comes, the spread to the other area has become much easier. And finally, I always believe in capacity building and health education. See, unless otherwise it is done, it's not going to happen. See, otherwise your knowledge, your expertise will become within this room. So the common man should know. A simple farmer should know that what is the challenge he will have when there is a climatic disturbance. How to handle it, how to medically treat it, how to vaccinate it. See, this is what ultimately need. See, in a Western world, it's all grouped together. It's a mass production, mass growing. See, where the knowledge infiltration is comparatively easier. If you are sensitized, few people with a veterinary knowledge, things are done. But in our country, it's all small farmers owning 1 or 2 cattle. The knowledge should be such a widespread that otherwise things is going to be a big challenge. The similar way, all your healthcare workers also should do it. And finally, with all things, we again and then coming back to the concept of One Health. See, unless and otherwise we are all work together, share our knowledge, share our data, things are not going to happen. See, whenever there is an influenza, you will have a better idea about occurrence before me. You would know the localized area. See, unless you have a preventive mechanisms, it's going to spread in a much wider area, much higher speed. The similar way Nipah, see, whatever infection you talk, is the common zoonotics which you're going to talk, it's going to be the problem. It's not only the present problem, your old salmonellosis, brucellosis, all those things, unless and otherwise we control in the human population, we as a human is going to get affected. Let us work together. Thank you once again for the opportunity. Thank you.